Hello everyone, today we will be going over inhaled anesthetics. Now the onset of action of an anesthetic is going to be determined by the solubility of the gas for the blood. So if the drug is not very soluble within the blood, then the onset of action is going to be much faster. So imagine that we give someone an anesthetic. First, the drug is going to be found within the blood vessel. If the drug is not very soluble within the blood, it is going to want to quickly get out of the blood vessel to reach the brain, and so therefore the onset of action is going to be much faster. If the drug is soluble within the blood, then the drug is then just going to accumulate within the blood vessel. So there's not much of the drug getting to the brain to produce the action of the drug. As a result, the onset of action is going to be much slower. Now, the potency of an anesthetic is going to be determined by the solubility of the gas for lipids. Okay, so what this means is that if the anesthetic is lipid soluble, then it can quickly cross the blood-brain barrier to reach the brain and produce the given effects of the drug. So we would need less concentrations of the drug to produce the given effect. So again, imagine that we give someone an anesthetic and these blue dots are representing the drug. And if the anesthetic is lipid soluble, then it can easily cross the lipid membranes to reach the brain because it can more easily cross the blood-brain barrier, and therefore we would need less concentrations of the drug to anesthetize the patient. Now, if someone is given a anesthetic that is not very lipid soluble, then it is going to have now that drug is going to have a harder time crossing the lipid membrane to reach the brain. As a result, we're going to need more concentrations of that drug to produce a given effect. Now, MAC is going to be the concentration of the anesthetic that prevents movement in 50% of subjects in response to pain. So, what this essentially means is that if the MAC is low, then we would need less of the drug to produce a given effect. Okay, so less MAC means that the drug is going to be more lipid soluble. As a result, it is going to be more potent, meaning that we would need less concentrations of the drug to anesthetize the patient. Now, one thing to keep in mind with lipid soluble drugs is that these lipid soluble drugs are going to first reach the brain, heart, liver, and kidneys because it is going to have an easier time getting to these organs first. But then over time, because the bone, adipose, and the connective tissues are a much bigger sink within the body, we're going to have more accumulation of that drug over time. So as time passes, we're going to have more of that drug within the bones, adipose tissue, and the connective tissue than the brain, the heart, and the liver, and the kidneys. Now, a good example of an anesthetic with this type of distribution is going to be propofol. So when you give someone that drug, they're going to be anesthetized quickly because that drug is highly lipophilic, so it is going to easily cross the blood-brain barrier to reach the brain and quickly anesthetize the patient. But after 10 minutes or so, the patient is going to wake up. Why? Because now the drug is going to be more spread out within the adipose tissue